the brevis tendon splits into two halves, which encircle the longus tendon. Flexor digitorum brevis inserts here on the bases of the middle phalanges. Flexor digitorum brevis assists in producing flexion at the PIP and MP joints. Lying superficial to flexor digitorum brevis is the plantar aponeurosis, which we've looked at already.
Now we'll look at the muscles for the big toe. To build up a picture of them, we'll first take the middle group of muscles out of the picture so that we're again looking at just the interossei.
The muscles for the big toe are flexor hallucis brevis, adductor hallucis, and abductor hallucis. We'll look at them in that order. Flexor hallucis brevis has two almost distinct parts, which arise here from the cuboid and third cuneiform bones. Flexor hallucis brevis gives rise to two tendons of insertion, which attach first to the medial and lateral sesamoid bones, then to the base of the proximal phalanx of the big toe. The tendon of flexor hallucis longus, which we'll add to the picture for a moment, runs between the two halves of flexor hallucis brevis. Here's adductor hallucis. It arises by two heads, an oblique head and a transverse head. The oblique head arises from the bases of the middle three metatarsals. The transverse head arises from the deep transverse metatarsal ligament. These two heads converge and merge with the medial head of flexor hallucis brevis, sharing its insertion on the medial sesamoid bone and on the base of the proximal phalanx. Medial to flexor hallucis brevis is abductor hallucis. Abductor hallucis is the most medial of all the foot muscles. It arises here, on the medial side of the calcaneus. The tendon of abductor hallucis merges with the medial part of flexor hallucis brevis and inserts with it here, on the medial sesamoid bone and on the base of the proximal phalanx. The main action of all three of the short muscles of the big toe is to produce flexion at the MP joint. In addition, adductor and abductor hallucis brevis can produce adduction and abduction of the big toe.
Lastly, there are two short muscles for the fifth toe, a short flexor and an abductor.
Here's the flexor, flexor digiti minimi brevis. It's an outlying interosseous muscle that's been given a long name. Here's the abductor, abductor digiti minimi. It arises all the way back here on the calcaneus. It's inserted here on the proximal phalanx of the fifth toe.
Now that we've seen the muscles for the big toe and the fifth toe, we need to see how all these short muscles fit together. To do that, we'll put the long flexor tendons and then the central group of muscles back into the picture.
First, we'll add flexor hallucis longus to the picture. Flexor hallucis longus lies deep to abductor hallucis as it enters the foot. Here's flexor digitorum longus, entering the foot along with flexor hallucis longus. The tendons of flexor digitorum longus cover up adductor hallucis. Here are the lumbricals, flexor accessorius, and last of all, flexor digitorum brevis.
Now that we've seen all the muscles of the foot, let's get a complete picture of the layer of deep fascia that encloses them all, the plantar fascia.
The central thickened part of the plantar fascia is the plantar aponeurosis, which we've seen already. The medial and lateral parts of the plantar fascia extend on each side of the plantar aponeurosis. On the medial side, the plantar fascia covers abductor hallucis. On the lateral side, it covers abductor digiti minimi. Here on the lateral side, there's a marked thickening of the plantar fascia called the lateral cord of the plantar aponeurosis, which goes from here on the calcaneus to here on the base of the fifth metatarsal. The lateral cord of the plantar aponeurosis helps to support the longitudinal arch of the foot on the lateral side.
We've seen all the muscles of the foot. Let's review them before we move on to look at the blood vessels and nerves of the foot.
Here's extensor digitorum longus, extensor hallucis longus, extensor digitorum brevis, and hallucis brevis. On the back, here's flexor digitorum longus and flexor hallucis longus. Here are the interosseous muscles, the lumbricals, flexor accessorius, and flexor digitorum brevis. Here's abductor hallucis, flexor hallucis brevis, and adductor hallucis. And lastly, here are abductor digiti minimi and flexor digiti minimi brevis.
Now we'll look at the blood vessels and nerves of the foot, starting with the veins.
The superficial veins of the lateral aspect of the foot join together to form the short saphenous vein. The ones on the medial aspect of the foot join together to form the long saphenous vein. In addition, at a deeper level, the arteries, which we'll be looking at next, are closely accompanied by concomitant veins like these. From here on, we'll remove all the concomitant veins to simplify the picture.
We last saw the anterior and posterior tibial arteries entering the foot beneath the extensor retinaculum and flexor retinaculum, respectively.
Here's the anterior tibial artery at the ankle, passing beneath the extensor retinaculum. We'll remove the retinaculum. As it passes in front of the ankle, the anterior tibial artery crosses beneath extensor hallucis longus, emerging lateral to it. It gives off branches to the tarsal region, then continues on to the dorsum of the foot. Beyond this point, it's known as the dorsalis pedis artery. The dorsalis pedis artery passes beneath the extensor hallucis brevis muscle, gives off this first dorsal metatarsal artery, and ends